Our December meeting is the day after Christmas.
It's gonna change, I think.
Family request.
Sit there with me.
Of course.
Good, I'm good. Nice to meet you. Maybe Tennessee is you. Research center.
Got it.
Say me. This is.
Oh, nice.
It's faster than.
There you
It's
go.
gonna happen. For you. It's like, yeah.
So when did you start? Like
On Monday.
on Monday?
Yes, I'm brand new.
Yeah.
But you're really fun, everybody's super nice,
Uh-huh.
so.
Yeah.
Very cool. Are you from Fort Collins?
Not originally, but I've been here since 2012, so about 20 years.
Have you been at CSB the whole time?
Yeah.
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 What department?
That's
nature, you know.
That's why I'm.
Yeah, it's a human development.
It's on,
family
like,
studies.
my manager.
Oh, nice, nice.
Yeah.
When did you graduate?
2011.
So
Uh-huh.
it's
Yeah.
just.
All right, so right before I got here.
That's what I thought, that's what I
Okay.
So.
Yeah, the center started in 2014.
And is that big beautiful building that's over on the corner on College and Prospect, or is that a different one?
Oh, I think that is that would be the back wall.
Oh, that sounds great.
Anyone else is gonna be?
Yeah, we have we share a building with a couple of
Usually do.
other centers in the college.
So
right.
the behavioral science side of this building. So what?
It's so yeah, that's where the department is, and then the center is in. It's right next to the.
It'll make for a short
Field house?
conversation.
Yeah, that part of the campus.
There's two, so
Yeah.
there's two, that's.
So we share space with the Social Work Research Center and the Center for Community Partnerships.
Oh, so all the good people that you want.
Exactly.
I was gonna say, I haven't heard, yeah, so we should. Usually.
So I kind of briefly looked at it, some of the testing. The all the RFPs, did you get the?
I just,
Yeah.
I think I'm gonna direct it to the state, cause I don't, or I could just say, we don't really use an RFP process for official meeting too.
Yeah.
That they should keep an eye on our website, I guess, to know if we ever go to that, right now it's good. Is that?
Yeah, you know, you could just direct them to the website and say, you know, to the driveway, what useful do basically post it from my driveway to my house, and then separated. They were for
All professional RFPs for the
state.
Yeah, so that's why I was like, well, and you probably want to check, I can direct them to Jamie or not James. Probably. There's probably a general mail.
Yeah, opioids, is it opioids.gov or something? Opioid.
Is that you?
COAI.gov. This one.
That was the seat I wanted.
And of course, that's the email address, maybe do that have that one. Like
So I
every
wanted
vendor
to-
and public.
I wonder if that's on their general website though.
Yeah.
I might get down and move the trash cans and sit right next to this nice man. General website.
That's what I'm gonna try.
State coffee, breakfast, lunch.
Yes.
Something to.
Yes,
Now that I have.
Good. So. Yeah, it says a college.
Oh, you got them too.
Yeah.
Now I'm not as.
But there's
in myself about it, so.
Yeah, it's about time.
Yeah.
This
thank you.
is. Just isn't that much money.
I don't know if this goes down in the.
I just.
You do?
It's got. It's got.
Goes up.
And it's worth, okay, you just needed a super test.
No, what I needed was competition. I didn't want you to do it when I could. So that's just like, I got this. Oh, okay. I'll be tracing my papers across. That is fascinating. About. Oh, crap. There are some executive decisions in there. Oh, man, you're so creative. Thank you for this. I came in the window and slammed the door shut. I was like, oh, geez. I literally just opened the door. Where's your? I just wanted your strengths to keep us up with us. No, it's just.
No, that
That's
is that
how
for.
you get stuff done.
Okay.
Okay.
I'm on the road 90% of the day, so.
Probably in there people's cars. Hello, hi, how are you? How are you? It's funny, but not funny. Okay. Looks like your mom for a meal at Lucille's recently.
My mom died in 2020.
I'm so sorry. I swear, I saw someone that looked just like you. And they were coming out of Lucille's and I had to stop for extra long in the stop sign. To let them get across. You're the doppelganger.
I think it's
Right
someone else
here.
that said that way over there.
It's uncanny. But I don't want to like yell out the window and scare. Oh, that's funny.
Well, you made it as long as my dad. We're both 80. Thank you very much. Yeah, she. As soon as the pandemic hit, she gave up because she was walking around and just finally had her at 7 weeks.
Oh, yeah. Just, yeah, the Glenwood got, you know, 74 hours to get back. Late last night. Rodeos this weekend, or next weekend, so it's a lot going on.
Okay.
I do have a forum, right?
Yeah.
Let's,
We got one more minute. and then
I'll
we'll
start.
We'll wait for.
And there goes my phone. Important family.
Don't worry.
They hold on it. So it must be 2 o'clock. Okay.
That's today.
4 years of consultation. Oh, you're not up to date.
I'm young,
I'm sorry, but I'm glad.
I think that's so interesting. We saw her in me.
I think that's taken. I know. See you. I already commandeered it. I'm sorry. So you guys, is it around, she gonna stop by or? I invited her to come to the meeting, but she is in the midst of training, but maybe I could have her just come over for a minute. I thought that would be great. That actually is a really good idea. I was
so
Let me go
pleased.
see if she can
I know.
get away for 5 minutes.
Yeah, I understand.
Oh, that's yours, okay.
Very exciting stuff. I was
Oh.
Yeah.
curious about this with my garage.
Do I say something?
My sure.
Thank you everyone for being here today. That's okay. So we'll call this meeting to order at 2 o'clock, and this is the Region 2 Regional Opioid Abatement Meeting Council, and Liz, are we recording?
Yeah.
We're up recording, we're live on YouTube. Awesome, good morning, or good afternoon, it's been a long day. I see all these wonderful folks online. Thank you all for being here. I am Vice Chair, Lamar County Commissioner Jody Shad McNally, and I am covering the meeting today because Chair Tom Gonzalez is on an airplane back from the National Association or Conference for Public Health Officials, Whereas I understood his department won an award, so congratulations to, let's see. The National Association of Community County Health Officials, I think. So a promising practice award. And I think there was free naloxone there at a display. And I think one of those, that award might be associated with the work that we're doing with the council. So we'll get more information later. But anyway, I wanted to just let you know that he's experienced and that's where he's at. But let's go ahead and, do we need to take attendance? Station quorum.
We don't know.
Yeah, awesome. So we'll just call for public comment. Is anyone here wish to give public comment? We get 3 minutes. And be online when I give public comment. Right, I'm gonna close public comment. Now I'd like to take a point of privilege as chairing this meeting to take a brief moment to introduce you to someone that's really important and will be probably coming to these agencies more. And but we're very excited and I'm very glad to have our new behavioral health director for behavioral health services. And I'm gonna let Laura introduce her. She's only been here for a couple of minutes, but I want you to get to see her and meet her and know about our new director. So Laura, I'm gonna let you.
Thank you, Commissioner, appreciate that. So as most people in the room, I think know, I had been serving as the interim director for this department in addition to my day job, which is as the human and economic health director for the county with multiple departments in my area. And so I am so grateful to have Amy Martonis joining us as of last Monday. She will be the long-term behavioral health director and she'll be officing here in this building. Amy comes to us with I've told people I had a unicorn job description that I needed to fill because it's a very unique position and there aren't very many other things like this out in our community or even across the country. And I did do a nationwide search and had to do that 3 times. 3rd time was the charm and she's the charm. And she brings a very diverse background, including clinical experience herself in behavioral health, managing large programs, managing grant funds. And she really is the unicorn I was looking for. So I don't know, Amy, if you want to say a few words to this group. This is our Opioid Abatement Council. You and I have talked a little bit about what that function is in this community.
Yeah, what an exceptional group to be together and serving our community. I'll be honored to be part of it in the future and have to be part of the behavioral health services team. Just starting week 2, so it's been an exciting week or so. I'll be very glad to join you all in this work as a member of this group.
Thank you. You're welcome.
Yeah, thank you.
Appreciate you coming. Thanks for taking a moment. But I wanted them to see you and
Absolutely, and I'll look forward to meeting many more of you and learning more about the folks that are part of this group.
and she'll be at probably our abatement conference September 30th and be at our dinner. So I'll have a chance to talk and pitch more. But thank you for
I
coming.
need to catch
Thank
up
you,
with you
Laura.
about that. We haven't talked about that event yet, but we will.
Thank you so much for
I
letting me
promised you
come.
already, Laura, sorry.
I know, thank you. No, it's good. I have a running list of all the things we need to talk about.
Yeah, it's part of it's time for Amy, so thank you. So thank you all for that moment of personal privilege, but I thought you'd like to know, we have that position filled. And thank you, Laura, for your months and months of service, taking 3 jobs on, full-time director jobs. So you've been doing a lot, and I just want to recognize you and your tremendous efforts and tireless efforts, and just thank you for all that you've done to kind of keep the ball rolling, especially opening this facility and everything. So I just want to commend you for your work and your dedication to the county and to taking care of folks. So thank you. So I appreciate it. Okay, so moving on to approval of the minutes. Did everyone have a chance to look at the minutes? Anything that needed to be adjusted or changed? Any names missed from? Sometimes we forget who's online, but I think it looked okay. Not usually I make the motion, but I'm sharing.
I'll move to approve minutes.
We have second.
I'll second.
Thank you, trustee Youngland. All right, we have a first and a second. Without further looking around, any further deliberation and discussion, all those in favor signify aye and raise your hand. Aye.
Aye.
Anyone opposed? Okay, the minutes are passed. Okay, so we're gonna move on to item number 4. So we have enough time to talk about our item number 5, which is a big part of our discussion today. I'm gonna turn this over to Carol Locke, talking about our fiscal and grant administration, and we're just gonna take 15 minutes. If we need to continue this conversation, we can do it at the next meeting, but I want to be really spending a lot of time on our year funding. And we'll talk about that more in a little bit. We have a lot of ground to cover in a short amount of time. So Carol, I'll turn this over to you. Thank you.
Yeah, I just want to cover, we need the council's approval for the January through June expenditures for the council. 10% of the opioid funds go towards administrative costs. And since Larimer County operates as the fiscal agent, they provide the support to this group. And so there's legal, there's accounting, there's grant administration, there's of course live support and getting the packets out and coordinating all of that. There's also, you can see the categories in your packet, but the time spent in developing reports and also helping with data and metrics. So the total for the first 6 months is not quite $30,000. And I guess I'm looking for a motion to approve that so we can reimburse the county.
Any questions?
I have one quick question. If I remember correctly, we had approved $500 for the lived experience stipends for each person. I could give 3, but there's only $1,000 there. Do we know what happened with the other?
One person declined.
Okay, that's what I thought.
Yeah.
Thank you. That's a great question. Okay, any other questions, concerns? Okay, I will look for a motion to approve these administrative costs to reimburse the county. As you can see, there are a lot of people who are doing a lot of county employees who are helping support this work, and I appreciate all of them and the work they're doing, because I know all of them are pretty excited and dedicated to this work. So I'm looking for a motion.
I'll make a motion to approve the 2024 administration cost for Larimer County Opioid Abatement Council.
Thank
I'll
you,
second.
trustee. Thank you. That's a first from trustee Youngland and a second from Mayor Pro Tem Mason. Any further discussion? All those in favor? Aye.
Aye.
Anyone opposed? Okay, those are approved. And the next item, Carol?
The second item under fiscal is the year 3 allocation amount. And I know you all have been waiting for those dollar amounts. And the state has released just preliminary amounts. So for 2025, it's 2.12 million, and for 2026, it's 1.64 million. And these amounts are before each of the cities and counties have formally opted in or opted out. So I believe they're likely to go up a little bit. So that's
doesn't have to report feature.
so 2.12 million and then 1.64 million.
For 2026.
Yeah. And if you look on the back of your packet, you'll see this little spreadsheet, and the 2025 amount is up at the top in the summary of the total amount. And so with that 10% taken out for admin, that's about 1.9 that this group needs to allocate.
So everyone will write that at the top of their agenda, so remember that's their number going for our discussion next.
And that's all I have.
Yep, great. Any questions for Carol? Carol and I have been attending the monthly learning opportunities, which have been very helpful. And just a side note, we're not going to talk about this today, but we know we have worked on the capital asset policy, and we kind of finalized that, but we're not bringing it back to council yet. I'd sent it to the AG's office for them and to the COAC to look at, to give us some feedback. And then we'll bring that back to you all. We'll not changed yet, but with their recommendations or their concerns or questions. So just want to let you know that's kind of, we've got that done, but we're trying to look for some more feedback. So, okay, thank you. So let's move on to year number 5, or item number 5. I feel like I've lived 5 years in the last 2 weeks, but that's okay. I love my job, this is awesome, and we're moving to this agenda, but we need, and I know we're going a little later today for our meeting, because we have a really important discussion, and let me just start this discussion for our 2025 year funding priorities. Is that, and I have to leave here at 4 because I have to travel up to back up to the mountains to do an open space tour at Training Court. And I don't want to get lost because they'll start without me, I know it. So as you know, when you look on the back of the agenda, I hope that you saw this. Just to reference everyone, this time that we have this quarterly financial report and approve our plan in August is gonna have to happen because it is due in September before we meet. So we have this meeting and the next meeting to approve this plan process, and then we'll have the quarterly financial and the 6-month reports. Now, you look at, there's a little room in maybe September and October, and I haven't talked to this with the chair yet, but I happen to be at a Purple Heart ceremony on Friday for a Vietnam veteran, and a bunch of the younger nonprofits with younger veterans who were actually texting with their nonprofit, which it caught my ear. These veterans who are actually talking to this nonprofit on peer-to-peer work, because they're all taking like 10 to 20 pills. Some of them opiates. So, okay, it's almost a year anniversary for me, so you have to forgive me. So it kind of rocked me, and I talked to them, and they're doing some great work, and they're really dealing with that age group that is maybe needing, this is opioid direct, trying to help these veterans manage their medications. So I talked to the Veteran Services Officer who helped present the Purple Heart to the Vietnam veteran who was never recognized until Friday by Congressman Goose, which was moving in as it was. But I thought that was somewhat targeted response that maybe we need to look at, because this is direct opiate response to a younger group. And I thought, so they're gonna pull something together. It's either gonna be ready for September or October. And I hope you as a council would be patient indulgent that maybe we found an area that we could help expand resources to and help these 30, 40-year-old veterans get some opiate abatement support and help. So hopefully they're ready, but I wanted to just kind of put a placeholder in September, October to bring that up. And this just happened last Friday. That's why I haven't had a chance to talk to the director, but to me, this seemed very appropriate. So I wanted to hope that you'll support me with bringing that on. Again, just want to show how packed our agendas are and how important is this meeting and the next meeting for us to get that plan. So first things first, and we talked about this as the chair and I and Carol, we were looking at what the learning forums, and we mentioned the buckets and definitions have been slightly adjusted and changed. So this was in your packet, and these are the approved recommendations and guiding principles for use and management of opiate settlement funds. They're a little different than what we had originally. Remember when we first started, they were kind of a little more open, because you kind of use these funds with these guiding principles, and they looked a little more flexible. That has changed, and there is a little more guardrails and focus. So I just wanted to kind of start off with that. And this is really important because I think this is also from the guiding principles from the national organization too. This is kind of coming from the national down to the state and then down to us. So let's just stop there for a second. Any questions or comments on that?
Is there an expectation to spend in each of these I'm wondering, is there an expectation that we spend money to develop a fair and transparent process for spending money? like different, like an RFP process or
No,
something?
I wouldn't say that they're talking about RFPs, or I think that just somehow we're having a process. And I would say, because we, and I'll get to that in a second, I'm trying to get in so I can read you the email from the AG's office. We sent our current buckets to them and then asked, can we crosswalk these? So we know what our current buckets are and how they kind of crosswalk to the others. So forgive me for having cybersecurity, which is great, but it takes me a couple more steps to get in. But as I understand, we have never been, it's been not told to us that we should have an RFP process. We just have to have some kind of process, which we do. We have presentations, and then we have this direct allocation. We have the 6-month report. We're having metrics. We're having a year-long report. But they are very impressed and think that we're doing a great job getting money out the door. And a lot, as we said, a lot of regions are still not quite gotten through their plans or gotten money out. And last year, as we learned at the conference, some of them hadn't spent any money but on a feasibility plan. So I think that that's not about that we have to do it a certain way, but I still think there's that flexibility for us to do how we're doing and what another group does. So I don't think that's an expectation, but that's a great question. And so, so I'm trying to get you this email. But you can see that these are, I'm trying to get to this comment. Okay, now I gotta verify it's me. This is not great. It's me, I promise, and I don't remember my password, so. If I don't find that, they know how, do they make you change your passwords every few months?
Oh, yeah.
Okay, and then do you not.
Sorry.
I didn't like it. I think that's the
Can't
first issue.
reuse, it's not.
Yeah.
I've done a variation of my kids' names 50 times.
So I had to do this at a
What are your kids'
conference.
names?
See, exactly. That's why they make me change it all the time.
You need more kids.
Oh, so
That is
anyway.
not the answer.
That's what I was about to
For
say.
everyone.
Well, I don't like changing it, there seems to be the most inconvenient time when I'm out of town and I have to write it down on a piece of scrap paper because it's not in my office. And let's see if that works. Fingers crossed, yay me, okay. The technology gods are smiling on me today, so, so I wanna read this from, Jamie, that you know, fellow from the AG's office, because, and what she said. Hold on, because we also just got another request from him about something different too, so,
And there's more detail for each of these lines.
so
Like
let's
for
go.
the fiscal one, the one that you're referring to, Beth, develop a fair and transparent process. They gave a little more detail about what that means to them. Strong controls for counting, records management and retention, transparent operating policies, procedures and practices. And then use of accrued interest on opioid funds for accrued purposes.
That's probably a lot because a lot of folks didn't use their funding. And so they accrued interest. That happened with American Rescue Plans for us, that we held on some of those, and then we had a lot of interest, but we used that, we kind of rolled that back into more grant things. So so as you can see, well, I guess let's just go through all of these and then we'll go back to this crosswalk. But I just wanted to kind of get to that we had been contacting them quite a bit. So we got the recommendations. The next one is how spending money to save lives, which I think that was one of, if you remember from our first conversations, that was a priority from the council right off the bat, was to get money out the door and spend money to save lives. And so invest in forward thinking opioid abatement strategies. To me, that means more upstream, more proactive, which we've done in a lot of ways. Add or expand effective programming rather than supplanting existing funds. I would say, yes, we've done that. If you think about all the things we've done that first round, we've all expanded the programs that we have started. And then identify appropriate staffing and operational tools for management of funds. And that has been what we have done through the county. We have been using our amazing finance director, Carol Block, and our other staff to kind of help keep track of all this and all the Davidson list and the great additions. So I feel like that one we're fitting, so any questions on that one? So then we use evidence for overdose prevention to improve health outcomes, so we haven't used utilized community needs assessment to develop a cohesive strategic plan. But we've kind of already had been doing community, there's already some needs assessments through the community and our community health, behavioral health plan, the 2.0. We have other, plans and assessments to meet, and we know with the Youth Mental Health Task Force and these others, I think there's enough data that we have been using, but also think about this as a provider, if we go out and ask the question again from a different agency, these folks are doing a lot of work, and I'm sure someone like MJ in the room, if we said, hey, we've already asked you this question from these other organizations, we're gonna come back and ask you from us again. That would seem a little redundant and we don't need to do that. So I feel like we've kind of done that already. I hope that you all feel that, but we can make sure if you don't feel like you've seen those plans or those assessments online or anyone else, we can make sure that that Laura will go ahead, Laura.
I was just gonna make a suggestion
Yeah.
for the group to consider, is that as you're building your agendas for future meetings, you may want to have some of the entities that have done those studies come and give a snapshot that is more specific to substance use disorder than maybe the whole gamut of what they were asking the community about. So somebody from the health district on their community health assessment, somebody from that, actually, it would be the health district again for the youth-oriented research that was done, just a suggestion.
I think that's a great idea, and maybe we need to do that in October since we have a little bit of that grant loan with the veterans group, and maybe that's already our.
And if you need any coordination help on that, I'm happy
Yeah.
to.
If we can eventually start to do that when Tom gets back into town, I think that would be a great one to do in October and kind of just get that'll be right after the statewide conference too. So it would be great to have that discussion kind of I think that's a great suggestion. So awesome. Next one is implement evidence-informed or practice-based approaches. Feel like that's what we've been doing. So anybody feel like they have any questions or concerns that that's not what we've been addressing? We've invested in community-led and community-based efforts. I would say that's true, and we actually have some folks who have been expanding and trying to get to other areas of the county that have been peer-to-peer led for it and reaching out. And so I feel like check the box there. And we've been partnering with local and state initiative data efforts. So, yes, sir. Yes, ma'am, yes, sir, and everyone else. Yes, we have. And so, and that's ongoing. We're investing in categories of harm, prevention, harm reduction, treatment, and recovery. Yeah, lots of different ways. Housing, harm reduction programs, outreach. We review core strategies identified at the nationals. We review core strategies as identified as by national settlements. I don't think we've done this really since the first year or so, or the first year where we looked at those national settlements and the core strategies. So that was one that I thought that maybe which we didn't prepare for today, but something that maybe we should just go over in the next meeting and kind of talk about and make sure we know what those are. And I don't know, we could go to the COAG and see if we can pull those up quick. I don't know if you have those, but so those, I feel like maybe that's one that we needed to review as we're finalizing this plan.
And Jody, those core strategies are in your packet.
Oh, you did put those in.
Exhibit E core strategies.
Oh, that's right. Okay,
Yeah.
thank you. That's why.
So many different terminologies,
So-
yeah.
That's why we asked for this. So the reason we asked for this is that exhibit E, sorry, Liv. You're right, they're not saying core Saturdays, but that's why we asked exhibit E. This is what changed with the COAG, is they added this exhibit E in these core strategies. I see it now. I'm thinking of it as exhibit E. That's what it's in my brain. And this is what we're using to crosswalk between what we've done and what's now the new one. So exhibit E is what we're talking about and looking at that crosswalk that we're going to talk about today. So we are gonna do that, but I wanted to remind everyone about that, and we didn't have that originally in the packet to go out with you, and I thank you for, Lynn to resend those out, because I do think you resent it out. So, and you notice how, if you haven't gotten through all this, how in the margin, it shows, I don't know if you saw this, it shows kind of where we put the money at in that core strategy.
Yeah.
And so I thought that was well done. And also, you can see with all of these different areas, there's a lot that is still stuff we can do, but at least just like our, that, visual of the pie chart, how it looks so balanced and when we covered some areas. I thought this was another way of showing that as well. So, and then you see the additional areas that the admin support, the conference, admin support, and the stipends at the very end of the last page. And appreciate that it's separated by year. So I'm assuming Liz did that. Oh, Carol did that. Thank you, Carol. So well done, and thank you for that. You've done a really fantastic job about that. So
I want to point out one thing about this exhibit E, just for clarity, it's kind of confusing because it's changed a little, but when they talk about 4 strategies, exhibit E has Schedule A and Schedule B. So Schedule A is sort of high-level strategies, and those are the things that they want everybody to keep in mind. But those aren't the strategies that you put money towards. Those are kind of like a roll-up level. And then if you go to Schedule B, those are the actual detailed strategies where you will be allocating your money to. So it's kind of 2 different things, the high level and then the detail. Does that make sense?
yep, thanks for spelling that out. Does anyone have questions so far? Okay, so the next one, utilize available technical assistance and program and expertise for COAD. Carol and I are pretty active and involved with COAD monthly, and I think they have been coming to our meetings and kind of listening in. And as you saw also, we've been talking to them about crosswalking our current buckets with our exhibit E, and we set our policy. So I feel like we've been kind of doing that. And then focus on equity, incorporate the voice of effective individuals into the opiate fund decision-making and management. I would like to ask our community members how they feel about that. Do you feel like we have incorporated your voice in these decisions and planning?
Sometimes.
Okay, that's good. All answers. Okay, and then we have. And I know Marshall's not here, but I feel like you guys have been great. You've been very frequent. You've been here all the time and very vocal and active. So we appreciate that. And then also we've addressed the structural inequities to improve outcomes and reduce stigma for those impacted by the opioid crisis. So I'd like you to keep that in the back of your mind as we're having this discussion. I think that's an important one that I wanted to spell out. And then incorporate an intersectional approach to health equity. So that's another one I want you to think about. And I think that's one of the big things having the health director here. Also, when we talk about that Laura's great suggestion about bringing some of the folks doing these assessments, that might be a good intersectional approach. And we have also an intersectional approach with CSU and the school districts. But that might be something to kind of think about. What other agencies do we need to have to make sure that intersectional approach is as comprehensive as maybe we need to look?
I was thinking about a story from my lived experience on the way over with my past that constantly haunts me is hospitals. And I met a woman at a meeting yesterday who has some lived experience like I do, and she's a psychiatric nurse in a hospital. And she said to me, I wish I would have known the things that you know. So hospitals, care professionals
That's a great comment. So let's think about that as well. Maybe that's some folks to invite to a conversation. So, great. Thank you for sharing that. Sure. And then, develop a fair and transparent process for spending funding. I think we already talked about that. And then, so on equity, yes, so we've gone through all those. So some things to kind of just set our, as we're continuing these conversations, just stuff to keep in mind. So I'm asking that maybe even to the next meeting, just to say paper that you bring back these slides with you as we continue the discussion. And you'll have them electronically. So, and again, just reinforce that we have, just these 2 months to talk about this. So first, let me share with you from the Attorney General's office from last week. And then we did have, okay, send a text to myself, and I didn't send a text to myself, that's really weird.
Don't open the attachment.
Yeah, I'm gonna maybe call on that. This is from Jack Patterson, with the AG's office, as he brings a lot of our meetings. And he added to our tabs, and I don't know, if I'm gonna send this to you. Is that okay?
Are you talking about the crosswalk?
Yeah,
That's.
oh, it's
here.
on here,
Yeah,
okay,
the new, this shows our old money in the new categories.
oh, thank you for that. I was just thinking this was our old tab, I didn't realize you guys put this in, so thank you, so go to this page, thank you. I'm just reading all these things, so, this is what they did for us on July 18th, and if we have more questions, they're willing to talk to us some more, so let's talk about our current, as you can see, we have, the, kind of the approaches that we had from 23 and 24, and how we looked at those, who was the grantee, and how we think these crosswalk going forward. So the community leadership planning and coordination is now leadership planning and coordination. Is that how I'm reading this?
I didn't put the old out there.
Okay, so these are all the new.
Yeah.
So these are the new categories and the subcategory. And this is what the AG's office also feels, that with what they feel matches what our crosswalk is. And that, so it seems like most of what we have done in the buckets will have somewhat new names from the old buckets, but all of our buckets crosswalked over, is my understanding.
Yeah.
Which is good news. So that should also give us a little bit of confidence that we were still we were on the right track before, now I've got a little bit of shift of names, but we're still on the right we don't have to describe or something or stop something because it doesn't fit the new categories. Go ahead.
Wondering if anyone on the council or in the room can help me understand how law enforcement fits in a treatment bucket.
We don't get to pick those big categories, so.
Right.
That's how the
There's a treatment
national,
bucket
yeah,
nationally, and we've moved funding co-responder units into a treatment bucket. When we know that only 2% of their calls could involve substance users, half of those being alcohol. I don't think that's the right bucket.
so if you look at Exhibit E, back to Exhibit E, this is the thing that the state has given us, and this is the thing that came from national to the state.
Right.
And if you look at Schedule B, yeah, there's the fraud category, treatment, and then there's each of these details. And so these are the categories that are given to us by the state through the national. We don't get to pick that co-responders in treatment and school-based is in prevention. We don't get to pick that. We just get to pick which of these detailed descriptions match what we're doing or what we're funding.
Yeah. I appreciate the explanation, I understand that. Okay. We continue probably the discussion for when we're talking about next year's buckets.
If I can add, Shane, it's probably the co-responder piece. Because that person, yeah,
No, and I understand all
yeah,
that.
but I see your question, I understand. With the law enforcement office.
I mean, as far as some lived experience, that never equated to treatment.
And I can.
And then we also from Marshall though, that his experience with law enforcement getting even treated got in there. So we have both kind of
Both sides.
both sides. So
It's true.
John, would you like to say
Yeah.
something?
Yeah.
Okay. Trustee Youngman, Mayor Pro Tem Mason, do you have some things you'd like to add?
No, I'm all set at this time.
Great.
No, I'm good. Thank you.
Awesome.
I appreciate the explanation though on the Schedule A versus Schedule B. That was on the core strategies versus the approved uses. That was helpful.
Yeah, thank you, Carol. That was really helpful because it took me a couple of monthly meetings to understand that Exhibit E is different. So what I'm trying to say is I felt very grateful that the AG's office got back to us right away and also helped us kind of understood this to save us a lot of time in this discussion about how our current budgets transferred over to these new uses. And so they're all okay and approved for that discussion. So DA Gordon McLaughlin, you're on the COAG. Do you have anything you'd like to add?
No, I don't. I appreciate all this work and I'm sorry I couldn't be there in person today, but so far this is great again. Thank you.
Great. Okay, so now let's go over to the allocations and look at those amounts in those categories. And you can see when we look at the 2024 allocation for prevention, we have a little bit of changes with the full continuum of care and some of the housing and also with the prevention on the G line. So you can see in those the grantee columns who those were and the amounts. And then looking at the administrative additional areas, we have a little bit of leftover, but that doesn't mean those that money can be used. But this time I would caution that we should keep that for overseeing costs of administrating as we go forward, because you can see they have increased over the last 2 years as we're getting up and rolling. So now looking at 2025, we have our allocation is $2.12 million, but with 10% taken out for administrative cost, we have 1.9. That just like last year, we thought we had just 2 million, then it went up, and so we might have more. And as you heard, the Supreme Court didn't let the Sackler family declare bankruptcy and get out of providing that money, which was a huge positive win and good news. And so we know that this number has a good chance, but maybe can't guarantee it to be up just a little. So I would suggest we start with the 1.9 million number, and we can always, it's easier to add than to take away. So I like to start with that number.
And Jody, I had an idea on that. I don't think it's going to go up a lot. You know, it might be 2.14 or something. And if it just goes up a little, we could just redistribute that proportionally to what you've already done instead of having to meet and discuss where to put $100, you know. That was just my thought.
That's a good idea. Go ahead.
Just a question as we start thinking about it. I know originally we talked about some of our funding being kind of seed funding, and the idea of in the future, our dependence on us would go down. And so like there's some questions, like for example, thinking of the co-responder unit and like expense for vehicles. Obviously, they don't need more vehicles right away, so that would come down. And is the sheriff's office looking at maybe taking over some of the funding needs for the officers? So I'm just thinking of where, and maybe we don't need to get into those details now,
But that was my next point.
oh, okay.
So, thank you for helping me segue. So remember that discussion that we talked about, that we figured the first year, and then we didn't want to be one and done, so we had told everybody it was gonna be about 75%, but it seemed like everyone came back with close to 100%, and not quite. And then we talked about maybe doing the 75, 50, and then 25 to kind of give them that glide path. And so because you're right, they don't need the more vehicles, but we want to kind of, these have been successful, and we'd like to kind of, keep that rolling. And we've seen this in behavioral health in the impact grants. We're looking at multi-year fundings because it is, it's nice just to focus and execute and not have to worry about applying for those grants again. So I figured that would be a good first step is, do we go ahead and go down to the 50% from the 75%, or where do you feel comfortable, but stagger that down? And then go ahead and determine that for these current buckets. But if we are going to do, would that be the first year, and then the second year, the other ones, did we put the second year ones, are those down to 75? So we're taking one group down to 50 and one down to 75, or do you know what I'm saying? There's ones that we just approved last year, and so do we, but I don't know if these agencies are going to come back. Because I don't know if Harvest Farms needs another 50,000 to do the septic tank.
Right, same thing,
Right,
so already their renovation's probably covered, so they don't need that again, but yeah, so I guess, and also. Looking at it percentage wise, like it helps, but also our funding is gonna be less. We're not gonna have the 3.4 million like we have in 2024, we're gonna have 1.9, so we have to, it'll be even less, potentially.
So I see some motion on the side of the room, MJ and Shane, obviously, but I see some verbal cues, so what is your
No,
concerns and
just-
questions?
I was just saying hello.
Okay.
Yeah, we didn't get to say hello,
Okay.
but I was gonna follow up with Carol on our subcategories, just since we do have those 4 buckets of verb. And I just put that as an action item for me, but in other regional councils, they have divided those buckets to correlate more specifically to those subcategories, and I don't know if that's valuable for the council or not, but knowing that the bulk of our funding is tied to that care coordination and peer recovery structure, leadership planning and coordination doesn't exactly fit the bill. And so that was my only thought on this, but wanted to.
So you're talking about the 650,000 for, so moving your category, maybe breaking that down in that subcategories. And so what is your thoughts? And I'm only asking MJ because I know, I'm asking her a question, she's not on the council, but I figured you have been getting the majority of these funds, so just curious with what that thought is.
Yeah, just knowing that, I think it's roughly 125,000 goes into the evaluation category of our work, right? And then we have the, I think, 350-ish that goes into the care coordination and peer recovery component. We've seen that get pushed into more of the treatment approved purposes bucket because of the coordination of care services delivery components. And then we have the community stigma reduction piece that falls into that third category, and the provider education component. And so certainly the second pieces play more into that community leadership planning coordination, so it's the eval, but I just don't want you to find us in the wrong bucket. Yes.
Yeah, and I've had conversations with the AG's office staff about that. Can we use these bigger buckets, or do we have to break it down into a bunch, every single category in exhibit Schedule B? And so far, they've been okay with us kind of lumping them together, and that really simplifies record keeping.
Right.
You know, if we took this and broke it down into three pieces and broke every single one of these into three, you know, instead of keeping track of this number of buckets, it'd be like 3 times. So it's more for expediency.
So I'm glad you brought that up, because that was gonna be my comment after you had brought this up, was I was gonna ask Carol. We've been in those meetings and saying, because this new plan that we have to submit is different than when we first started, and so I was gonna ask her. How detailed do our buckets when we submit this plan have to be? Because you know, as we've gone on, we've approved the buckets and the amount of money in the bucket, but then we provided the more details as we've gone on. So what you're saying, Carol, is, and this is what I understood as well, is that having those buckets approved and having amounts, and we can provide more of the details that you're speaking of later, when they provide the proposal. We don't have to submit that to that level of detail, and probably better that we don't. Is that what you're saying?
Yeah. They, you know, services aren't so neat that they perfectly fit all of these categories, right? Because organizations might provide multiple services. And the direction we've gotten is that you can pick the one bucket where the majority fits, rather than breaking it out into a bunch of different buckets. That's just for ease of administering this craziness.
I definitely appreciate ease, and I feel like it looks like we don't do anything in the connections to care section, but I think the majority of the work that your group is doing is in that. Yes, we have that piece, a very important piece for analysis, for reporting, analysis, and that kind of stuff, but the care connection is, there's nothing in there.
So you're talking about C on E6, just for everyone to be on the same page?
That's what I was looking at.
Yeah, so, you know, if you think there's a better bucket for that, going forward, I think that's fine.
I guess and because probably things are gonna get rolled out, and that's how it's been being reported. So we have a pretty significant chunk in community leadership planning coordination, which I think we do have some there, but we don't have anything in this connections to care, and I think a large amount of what we funded is really in connections to care.
I would just suggest that,
Hi.
given that the council is making choices about buckets, right? And the council had asked me in a presentation, you know, if funding is decreasing, how would you prioritize this work going forward, right? And I said, I'm gonna hold my staff up highest, right? And that's that care coordination and peer recovery support structure, and all of our work is you know, researched and evaluated robustly, and that care coordination model is held up nationally as best practice. So I'm gonna keep pushing to really reinforce that infrastructure.
Thanks for the insight. Mayor Pro Tem Mason.
Yeah, well, I just did want to point out to the council, and I'm not sure if that was Ms. Yant speaking earlier, but that connections to care bucket, if I remember correctly, 2 years ago when we kicked this off, that category didn't technically exist, right? So this whole you know, Schedule B approved uses thing, some of these are newer for this year. So I would agree that some of the work that we're doing probably does fall into that bucket. Just we've not categorized that way because that simply didn't exist in the past. So and I certainly understand where MJ is going with all this. You certainly the subcategories, maybe there's work to do as far as when we crosswalk over what we've already done to what the definitions that we've got matched from the AG's office, but
Lost you there, Mayor Pro Tem.
oh, can you hear me still? Maybe. Well, anyway,
Sorry,
the
Mayor
larger
Pro
point
Tem,
I would
we
try to make.
lost that last 30 seconds.
Uh-oh. Can you guys hear me now?
Yes, thank you.
Okay. Yeah, I apologize. The the larger point I was gonna say is obviously we may have some work to do in as far as crosswalking these items back over to the new definitions, but I would encourage us to maybe be looking at the specific subcategories that we might want to look things into. That way we can determine, you know, where this money is going to go. Yeah, certainly we can work on the definitions and that sort of thing that at a, you know, later point.
Yeah, and to clarify, I know this is very confusing, it's confusing to everyone, but we gave the state our current buckets for 2024, and we said, okay, we don't know where they belong in this new schedule, so crosswalk those for us, please. And this is what they gave us. They said, based on how you chose to spend your money, this is what we're calling these buckets now. These are their names. Now, if you feel like they didn't pick the right name or something, you know, we can change that. Or like for 2025, if you don't like any of these buckets and you want to pick something else off of Schedule B, Schedule B is your menu, think of it as your menu. You can go ahead and pick something else off the menu. You can pick anything off the menu plus any of these.
But for your already again, we have been talking with the AG's office and we gave them our current buckets in 23 and 2024, and this is what they say. This is how they kind of help us transfer our current work over to what they're calling it now.
Right.
Yeah.
So that was kind of the larger point I was trying to make is, you know, rather than concentrate on what the categories are of the, because really we didn't define those, right? So, but really what we should be concentrating on is the individual items and where we want to spend the money. What it rolls up into as far as a definition wise, I don't really see how that matters a whole lot in this particular. Obviously, the mission at the end of the day is to get these funds out to where they need to go in the categories that they need to be. I don't think it's really a big deal what the larger overall, you know, category or whatever is titled. That's I would encourage us to move on from that.
Great, thank you, Mayor. Mayor Pro Tem. Okay. So there was concern about from Beth on connect people with who need help who need help with the help they need, the connections to care. And that is a menu, that's the menu, I can go that. And so that would go under that bucket, correct? The big different connections to care bucket, or would that be in their treatment?
Well, as I'm reading, the smaller part of the description is actually pretty good. I don't know if you looked at that yet.
Yeah,
It's the title, yeah, so, and if it doesn't matter, then I just wish there were, I mean, for a little better, but.
Yeah, like Caroline said, this has been, it's taken us a little extra time and more questions to kind of understand these new categories. It's just, this is what we have to work from.
Yeah.
And that's why we thought it would be as a first step to kind of have them help us crosswalk with what they think and what they approve, so that when we submit, they won't come back and say that doesn't fit. So we thought we'd take that step first.
So if I may, Chair, one of the big ones that I noticed, and you know, obviously from 2 years ago when we did this exercise, some of these things, like I said, that were not here on Schedule B. So there's a lot of new things that they've brought up, certainly involving pregnant women, neonatal syndrome, these types of things. These were not things I think we had brought to our attention last time we went around this. So I would encourage the council maybe to consider some of the newer items and whether we want to add things to our current roster as far as categories go, or whether we want to stick with what we have. I know a lot of the discussion we've had in the past has been around trying to keep funded grantees that had already applied and have applied, and whether they may or may not reapply again. So Obviously, I think it's important we keep some of those things funded and keep those funded for next year and keep that in mind, but also to consider some of the newer categories that have been brought to our attention on Schedule B.
Thank you, Mayor Pro Tem. Trustee Youngman.
Thank you. I agree with Mayor Pro Tem Mason. What struck me in the new the buckets to choose from was number E, as far as pregnant or parenting women. I would like to see if we could look for to fill some of those for that bucket. I would like to also, I agree with bringing down some of the money funding amounts that we've done in the previous buckets, as we had indicated we were going to do, so they can be sustaining on their own. So I would like to see number E be placed into our buckets. Thank you.
Great. So Liz taking those notes, so we can add that. But we can vote on that. We'll take some votes here at the end about what we'd like to add, and then we have this meeting, next meeting to kind of finalize that. So, I guess, we've added one more bucket in E. Unless we all go, when we vote on that, let's just, maybe take a chance for the, folks to say, are there any other buckets do people feel strongly on the new exhibit E that they really would like to see added? So we can have that for the discussion. Also, Trustee Youngman, we can make buckets, but we also make sure that we find appropriate providers to provide those services.
Well, and that's what what I didn't know, I kind of I wasn't in on the very beginning of this process, and so I wasn't sure if if we are able to find, do we put the cart before the horse or whatnot? So when I was reading through that was one of my concerns, but definitely an area I think that needs to be looked at heavily, and I'm sure needs to be addressed, whether or not we can find, that organization or what have you to facilitate that. I don't know, but yeah, I agree.
And I do think it's a possibility, but I also want to just caution, we could create a bucket, but we might not find the right fit. So.
And I'm actually not sure that that's maybe much of a problem. I mean, when we had first gone through this exercise, right, we didn't necessarily know who the grantees were going to be that applied, right? Obviously, the sheriff's office would be one because they're kind of the only game in town, if you will. But the rest of them, we really didn't know. So I guess what I would say in this regard is I would like to see us maybe allocate something towards that particular new bucket. If it doesn't get used, or we don't have somebody, a grantee apply, certainly we can move that to a different category later on if we'd like to.
Carol, can you remind me that when we put in that plan, how with this new system, when we have to amend our plan, because before we had a little bit of extra time, we made those buckets, but we had a few months to fine tune it. Remember, we had to have it approved by September, and then we had to finalize and fine tune it by March. I know this plan is different. If we do not get this plan submitted by September, we cannot get our funds until March of the next year. So I want to make sure everyone understands why I'm really trying to finish this conversation. Last time we had a little more flexibility. We don't have that flexibility, but I'm also trying to remember how much flexibility we have for fine tuning it once we approve it after that.
As far as I know, we have a fair amount of flexibility. There's a freeze period where you can't change it, but then You can go in and move it between the categories.
So if we don't, then we can just
Right.
move
If you
that.
allocate it to a bucket, and you don't have any providers, you can move it someplace
And
else.
that's kind of how it was last time, but I just want to
Yeah.
confirm that, so. So that's, so let's just take a quick vote.
I have a quick question for Carol that pertains to that. So could we develop a bucket for the Schedule A, the core strategies? It's a core strategies bucket. And then perhaps, right, we know that we have funds allocated into what is seen as core strategies. Those could go to prenatal care or other areas within there.
Yeah, the course, we have to report to the state. Our plan has to be filed based on these Schedule B buckets.
Okay.
And they kind of roll up to core strategies, but they want us to allocate at a more detailed level.
Thank you.
Chris,
Yeah, thank you for the clarification there, Carol. To be clear, really, Schedule B is the menu of things that we can pick off of, and those things roll up into Schedule A.
yes,
Yeah.
Chris,
I too wanted to see more of a bucket for women, and that one certainly fits, that jumped out at me. For babies and mothers. And you can definitely find those programs if you seek help from children, youth and families and the foster and grandparenting.
yeah, that was probably my, I know Laura's here and I know there are probably programs, but I just want to make sure that they're. So Laura, do we know how much, I know those problems, we have those clients in our services now.
And the nurse family partnership out of public health as well.
Yeah, so,
Yeah.
so we know that's there, but I just don't want, I want to make sure we're kind of reaching out and inviting, groups that have proven track records in Limerick County and kind of doing that, so.
Yeah, I think Tom would have direct knowledge for sure for the programs, the maternal child programs that run out of his department. And we could certainly consult with that, Paul, who's in charge of our child welfare division and human services. Yes.
So, so again, I want to say what we've been doing and what, and we can add that other bucket, bucket E. And let's, so we have that noted, and then we have the, concern from MJ's organization, MJ, our organization, that, what they're doing is maybe reaching out into two buckets now, is what they're saying. And so, but that's for me, as I understand it, we can move those numbers and shrink the buckets, so I don't know if that's something we really need to be concerned, we just have the bucket up there, so the buckets that we address for that and they're for the room, they're all there. So, and we add E, and I also want to caution, that if we add a lot more buckets, that means we have smaller pieces of the pie for everyone. So,
And I think on E, they're going to want us to say, do we want E1, E2, E3, E3, to go down another level?
right. And I think that's what we can do at our next meeting. So, but let's get here's the bucket E. So we're adding bucket E. And so we can at that time, as we explore what's available, and what's, then we can talk about whether it's E1 or E4 or what has that. So I don't think we need to get that detailed this week or this month, so, but I don't hear any voices saying no to adding bucket E. Speak now if there's concerns. Okay. Unofficial vote, but we'll take that all later, so. So, being that, I feel like we have consensus that what we have up there and adding E, kind of what we'd like to work from for buckets with the new categories.
I'm interrupting, but I see it's 3 or 4 on between 6 and 10 that I might know about. I'm happy to do some research on it.
Yeah, let's,
A couple of programs.
yeah, let's have Tom bring back what's already kind of happening, so then we know we can expand, since we can't supplant funds, we wanna expand, we wanna, cause remember that guiding principle on there, so.
I can ask Dad about some of these.
Yeah.
They're still going.
Yeah, so, there's lots of great things here. And so now is that discussion, I think, because I think it'd be really nice to have, to know what we have put aside with what we kind of agreed to all along about stepping down. So I'll go back to that question I had before. We have the first year of rounds. I got funded 1 and 2, so it'd be 100, then less, and now maybe we go down to 50. And then we have the second group that would not be under set, but step down. So what I'm at, that's the question I have first half. Do we consider those 2 different step downs? Or we put them all in the same bucket of step down to 50? Or we want to stagger those?
Did you step down from 23 to 24?
We did,
Okay.
just a little bit. Some didn't, some actually came asked for more.
Oh, that's.
And we remember we had to go back and adjust and say, no, it has to be less. It's about,
I think the only question is, I think it's for those specific programs, right? So it's not the category that's stepping down, just for clarification, it's actually the specific programs
Right.
that are stepping down. And then some of them, the ones that came on new this year, next year would be their first step down.
right,
Right, okay.
that's what I'm asking.
Yeah.
And
And
so,
some won't even have a step down, because some we've identified, like Harvest Farm's an easy one to, they're doing renovations. Unless there's something new that they're gonna ask for, there wouldn't be a step down.
and we don't know, we don't need more vehicles, so then we know that's not, but they actually stepped down already. They stepped down quite, I think you were almost significantly, so Shane, I see your hands up. Oh, and then trustee Young.
I guess I'm wondering about process here. If going at this with a blanket strategy of stepping down on percentages across the board. I don't know if that makes more sense than looking at individual programs and efficacy, right? We have received guidance here about cost-effective use. I feel like as we go through our different grantees and the data that's been collected by some of them, we can see that some of these programs are extremely effective, and are we doing the best service to the community by stepping down funding where we're getting really good ROI? I feel like maybe there's a more detailed process that would better serve the community and how we start to parse out the reduced funds for next year.
And to follow on that, you know, today you're not really deciding what grantees get what. You're really deciding what are important areas. Where do we want to spend our money to achieve? What are we trying to achieve here? What's our goal? And then once you know your goals, your strategies, then you go, okay, now who can do that for us?
Right. And I think that's important, and I'll make a point after that. Trustee Youngman.
Yeah, I think that point's really well taken as far as measuring ROI and taking other things into consideration when we lower down the money that is distributed. I think it needs to be a complex, not just, okay, you were in it for 1 year, so you come down like, 75% or what have you. So I do agree that we need to take a better look at, like Larimer County, for instance, there's no vehicle. So what's that take? What amount are we actually looking at that actually goes to the first responder clinician? But we want them to sustain what they're doing as well without these funds. So we need to, yeah, they could be having a great ROI for the community, but we don't want to provide that constant crutch. So I think there's a happy medium there on that, is what I wanted to voice. Thank you.
Thank you, trustee Young, and I agree. Mr. Voss?
Yeah, I just, as looking at your history, don't forget this, some of these things were one time only, like Harvest Farm does not need another 400,000 next year to do another remodel. That was a one-time thing. So don't consider that when you go, how much should I put into that bucket? That doesn't mean you don't want more in that bucket. That just means they're not going to, I would assume they're not going to ask for another $400,000 remodel, an improvement to their operations. And so I think it's not as simple as just, what did we give last year? We only got this, and we're just going to step everybody down 25% or whatever it happens to be. Thanks.
Yeah, I think that's true. You might say, well, Harvest Farms doesn't have another remodel, sorry.
Not trying to pick on.
Not to pick on you, but we are. But, we think housing is incredibly important. So maybe we're going to increase that bucket, but we're going to give it to a different provider.
Right.
But it would be, I guess, in Harvest Farm is the point of contact or discussion. I would say, yeah, I don't anticipate us doing another $400,000 remodel, but I do anticipate that we would at least attempt to request support for supporting the additional beds and increased capacity, but certainly not at a rate of a $400,000 investment to do so.
So,
I was gonna make the point actually that you just made, that I was gonna go back to, I agree with what everyone's saying. I think a more like strategic look at how the funding's going and then where, but with the very upfront notion that this funding will come down. We can't sustain every program forever or through the next 17 years. So we will have, in order to fund different things, we'll need that. But I did want to say for a bucket, because as we added to buckets last year, knowing that the amount's going down, we may, and now we're adding another bucket. We have to look at the ones we're already funding and do we want to continue to fund in every category and adding one, or do we want to cut anything out? I would say I would strongly encourage us to keep recovery housing in there, because I think that's something that is a need, especially in our area. We know about housing costs and everything, so I would put a plug in to definitely keep that.
great, thank you, Laura.
If I may just give some suggestion here. When is this due?
We have to approve this plan at a certain level next month.
Okay, that I would suggest that at least the studies that we already have, even without the organizations that sponsored them or ran the studies, we do have that data available.
Mhm.
And I would be willing with maybe a couple of other folks to go through what we already know from those studies to help guide the decision-making here. And maybe bring a proposal, if a small subgroup could bring a proposal back to the August meeting so that it's a more targeted, it's kind of like that limited menu. I like that term that you used, Carol. This is your menu, this is all you get to pick from. But at least a starting point, which is maybe a little bit easier to come to a voting decision. So that's one suggestion. And I'd be willing to help with that. And then the second thing I just wanted to offer for the sustainability piece of things. One thing you might want to consider is that when a grantee comes back to ask for continued funding, a criterion that you could add to those applications is what their specific plan is for sustainability beyond. And that could be a criterion for even giving second, third year, whatever. It's just a consideration.
I think that's the question we did. We did add already.
But I don't know that it's been put in as I haven't gotten the impression that it's been put in as like a kind of a pass-fail criterion.
Okay.
It's something we want to know, and that's good information to gather, but I think it might need to get pushed up higher. What I'm saying is potentially push it higher on the prioritization of whether or not you consider that application for any further funding if they don't really have a good plan for beyond.
I guess my point is to have this conversation to talk about, we did talk about stepping down and making sure that everyone knows that we all have seemed to be consensus building that we don't want anyone to think that this is going to be the high level funding, because we need to start kind of, we're going to start seeing this decrease, as you can see from those numbers. We won't have a year like we had last year for sure. So I think that adding a bucket is important, because it seems that that is a very direct response, and then also, you know, this veterans group, I don't know what they're gonna come for, but that to me would be part of recovery and treatment that would fit in those buckets. So first, let me just get from there with, since we crosswalk these and we know what we've done before fits into these buckets and we're adding bucket E. We worked from those buckets in our previous work, maybe how you feel about having, because they do, Laura and them do work on these grant things. To help us kind of come up with, because you remember the years past, the last 2 years, it's years, but we kind of figured some general buckets and we had people present and then we try to slot them into those buckets. We don't have time for presentations this time. We need to approve our plan and then have folks come in and for those specific approved buckets that we have. So we're doing a little different this time because we don't have time to have the presentations and roll that out. So, since we need to have this so we can have something a little more formalized for the next meeting, and that's why we did this crosswalk before we got to this meeting, so it'd be, otherwise we would spend the whole time trying to do that ourselves. So I hope you all understand that was, I'm really grateful that the AG's office responded so quickly. Adding bucket E, if we go ahead and vote that these will be our buckets with additional E going forward, not talking about sizes or details of E1 or E4, but just the general B, J, D, B, G, H, and E, and administrative costs.
I would make that motion.
Pardon?
I would make that motion. That,
Do I
oh,
have a second? Do we have a second?
I'll second that.
Any further discussion?
One question, Carol, I think you've said this before. When we have the categories, then we have the buckets, then we actually put in percentages, not dollar amounts to start. So
Yeah, well, we could put in the dollars, but just if we end up with a little bit more money, let's just increase it proportionally instead of going through the whole thing again.
And those, we could actually put in a change down the road if we want.
Yes.
We can do these buckets, we do the percentages, and then say in December, we get different, or like, oh, we need to change this, we can actually put in a change.
Yes.
That's what I'm saying. I don't know if we can, but we have to have a plan submitted, right? Or we won't get the money.
Yeah, so we can do this, but it doesn't mean everything is like you said,
It's, we're starting to we're making this batter, but we haven't fully baked the cake, or we're adding all the things into cement. It's not cemented, it's a cake, and but at least we have the ingredients we're gonna use at this time. It's a shame.
Quick question for Carol. So the bucket you were speaking about falls under treatment.
Mhm.
So, what are we talking more about expanding the treatment bucket, or do we need to actually add line item E?
You have to actually
Because
add.
we don't have
E.
line item D
You have to
for the
add,
co-responder units, it's under treatment. Currently.
it's D, and then, but we're adding E as another bucket.
D1.
Oh, I see now, okay.
Yeah, you have to go down to
My
the
bad.
lower level.
Yeah, my
Yeah.
bad.
So then we'll have another treatment line.
Second.
Yeah,
Yeah, right, yeah, so we have two treatment lines. Sorry.
You hear
Shane, guess what? It's hard. Shane,
It's hard for me.
that's why we asked them to help us crosswalk this, because for all of us being, Carol and I've been religiously going monthly to these meetings, trying to like navigate these changes. But that's why I asked Carol that question. I knew the answer, but I asked it all for you to hear that we're approving these, but these are not, we are able to still tessellate things. I'm trying to get away from the language of my youth, because we're not really massaging this, we're tessellating.
There's too many letters.
Right,
So much
so,
alphabet.
so right now, the motion is that we're gonna have these buckets. J, D, E, B, G, H, and administrative costs. We've had a motion for a first and a second. We've had discussion. All those in favor? Aye.
Aye.
Anyone opposed? Okay, that motion passes. So, yes, oh,
I'm sorry, I know I'm not on the council, so I don't have.
well, we
space.
usually don't allow others to comment, but since I allowed MJ and Harvest Farms, I let you, but usually we don't let people who are not, usually that's a rule for folks who are not advisory or on the council, we don't let, but would you identify yourself and briefly speak, but normally we don't do that.
My name is Dave, Executive Director of Emmy's House Foundation. Just real quick question for clarification. Will all buckets be taking a percentage loss every year? Or will that only be going to certain grantees?
We're going, these are the buckets and we are going to decide next time and probably going forward as we're having Laura and her team from the county work on looking at what we've done and the percentages. We're going to be talking about percentages next year and they're not, and I don't think we've decided the buckets. It's not the buckets that are changing in percentages, it would be the amounts that we've had before, the grantees that had before. And all of these grantees that have been rewarded before know that they're not going to have the same amount for that, what they have applied for before, they've had, so they know that's gonna be a less amount. So
Okay,
that
thank you.
doesn't mean the bucket is going to change, just that grantee.
Thank you.
Thanks, so. Okay. So just for, we've heard some focus, conversations. We've got the buckets and now we're just gonna talk about the menu. I've heard priorities for some folks is the women focused and women care for women and children. Connection to care. Housing. Veterans, I brought veterans. I'm still very thinking that diverting people from the criminal justice system into treatment is important. I still think prevention for youth-based programming is important. Yes. I still think harm reduction is important. So you can see a theme here. We think these are all priorities. So at least we got the buckets approved, and I wanted to kind of just let you all kind of look at that list again, and then if you would just take a moment, look through your menu and thinking about that we don't have to know exactly what or who for next month. Thinking just all we have to have is kind of that J, and as Carol said, maybe a J3. Or a J, is that right, Carol? We have to have like J3.
Yes, you do. You have to have the detail for those. Yeah. So you can either use your existing detail or you can say, nah, we don't want J3, we really like J5, or I don't know how many J's there are, so sorry.
Go back.
I guess I would just add to your list, I think in G0, anyway, the one that's for Yarrow Women's Rescue, the social connection, that piece, did you put that in your list? I wanted to make sure I think that's something you want to.
Well, we approved bucket G, and now I'm trying to have you all look at 3 and 1 and 6 and 2 and 9 and 0 and 9. And you're right, last time we talked about housing and social connections, and we could fund it that way. Now, we have to use this menu, we can't just say social connection. We have to say G.0. Does that make sense? And that's why this crosswalk is so important. So that you can see ones that we funded that were a priority, like social connection for G.0. So we can't talk about that it's social connection, but we can because that's what was important to us. But now we know that fits under G.0. Does that answer your question?
Yeah, and it looks like there's a lot of overlap, right?
Right.
So I think you just have to keep that in mind. To add more confusion.
Yes.
Because we need more of that. Some of these
it depends on what level you need to go down to. Like G says, support efforts to discourage or prevent misuse of opioids through whatever. Include but are not limited to the following. So you can put it at that top level, or you can, if you want to fund it, something that you know, you can pick 1 through 12. So under G, you could say, we want all of our money to go to 1, funding media campaigns to prevent opioid misuse. We think that's the best thing to do with our money. Or in this particular category, you could say, we want it to just go to this top level, broader description. And to make this even more complicated, that is not true for every category. There are some categories where they want you to go down to the detail items.
Well, I was just looking at J. And I think Shane and I have talked about this. Under leadership planning and coordination, it says support efforts to provide leadership planning, coordination, facilitations, training, and technical assistance to abate the opioid epidemic. I mean, how do we stop it at its source? When that would be our real goal through activities, programs, or strategies that may include but are not limited to the following under J. I mean, that's huge. And we're doing a ton of that, and that's why so much is under that category. But that's so broad.
Yeah, so in J, they would want you to go down to like, to the more detail, right? Because J is so broad.
It's so broad. So we're hoping everything we do helps them abate.
Right, that's the
Right.
big
Epidemic.
Right. So again, this is why we have to know this crosswalk, because we found this very confusing, because now you know why.
And we're doing 2.
Right.
Dashboard.
Yep. And that's
4.
But let me just go back to that. Right now, a lot of that dashboard costs, other than what's in the contract with NJ's group with Butler, all the other dashboard stuff's kind of administrative because county staff is doing that. So we really should, down the road, as we think about, especially if budgets get tighter, and we want to maintain that dashboard, we're gonna have to maybe look at using some of that J to help support the dashboard work. Does that make sense?
Maintenance or the
Yeah.
upkeep
and all that. Just saying. If you think about it,
That has to be forever.
for the next few years, so think about it, trustee Youngland and Mayor Pro Tem Mason and Beth representing for Collins, and we don't have do we have Counselor Black? And the county, it's really easy to show up and our staff have the room and we have staff doing the counting, the finance. And I still feel like our staff are amazing, and I think they're under-reporting still. And I do, because I know, I'm looking at Laura, and I know you guys are. Because I know that's really important, and I know John and them, because they're in these meetings, help us make these agendas, so. There's a certain point, that we have to think about how we all contribute to making sure that's addressed too, that it's thinking about that, because that might come where we have budget constraints. Heaven forbid that things pass this fall, but it's something to think about that we might have if certain initiatives pass, so. So I think, again, for Carol did such a phenomenal job showing kind of besides on that spreadsheet, but also on this menu where that fits. I think it's really questions for you all to think about is we've got the number of buckets, and now we have those, like, it's easy to do 1 through 6 or 1 through 12. I'm thinking there's some things, maybe it's easier for us to look at some of those same items under those buckets that we, things like, the one I'm looking at, for what I thought about here. Where was it? Funding media campaigns to prevent opiate use. There is the connect effect, there's this, we have other people with social media that we can amplify their voice, but do we really need to put a lot of money into a media campaign? That might be one that we don't need to put on there if we did 1 through 12. I don't know if we need to do that. I think we want to try to make direct money into care. Corrective advertising or for affirmative public education campaign based on evidence. That's already happening. Do we just amplify and use those campaigns already, right? I'm seeing you shaking your head. Is that true? I mean, you're shaking your head, I'm assuming, because I can't tell if Shane's talking to you or you're just trying to.
I think he was making a nod.
Yeah.
If you're referring to school-based
Right,
educational.
Yeah. Number 3, public education related to drug disposal. The Northern Colorado Drug Task Force is already doing a lot of that, and some of the pharmacies and stuff. I don't know if we need to directly do that, we can just amplify again the work that's already out there. And the drug take back disposal programs. We just probably need to identify those and help see how we can amplify that. So I'm thinking like, maybe we need to, instead of trying to figure out all the numbers we want for 3 and 6, 1, 2, if we can find out the ones that maybe we think we like, like those first 3 under G, 1 through 4, I would suggest that maybe we don't need to consider those right now. We don't need to say 1 through 12. We can maybe say 5 through 12. That gives us a little bit of flexibility.
What, G has 9, what?
G has 1 through 12, so I'm saying 5 through 12 because we see there's a lot based around 9. But then I also see funding community anti-drug coalitions that engage in drug prevention efforts. That's pretty broad, but I don't know if we need to, so maybe 5 through 12 on that one. That's what you're saying, Phil, we can kind of be that broad and then we can back it up, right?
Yeah, so in G, the COAG thought that 2 of our things fit in here, and one had to do with the stigma. And they said stigma fits under prevent misuse of opioids, but it's not one of these specific strategies, so that fits under 0, right, under support. And then they said, okay, but the school program, that definitely fits under 9, so that's where that one goes. So that's how they kind of fit what we had chosen into these categories. Now, there's nothing that says you can't, you've started with the same big buckets, but you could also continue with your same categories that you used last year from that spreadsheet, if that's, if those are still what you want.
And then just add to them. Okay, and Mayor Pro Tem Mason.
Yeah, actually, I did just have a clarifying question. Ms. Block, if you might be able to answer for us. If we select the 0 categories, are we able to, does the system allow us to further refine those later on, or do we have to, if we pick G9, for example, do we have to, does it let us, is there any opportunity for tweaking that in the future, or how does that work on their side?
They want us to do it down to the lowest category that we can.
Okay, thank you.
Yeah.
Even at this point when we're choosing the buckets.
Right.
So that's kind of why.
That's how the plan gets filed.
Yeah, so that's kind of why I wanted us to get the buckets, the G.
G that way.
Right, Laura, so this is what you want to suggest is go back and help us look at these subcategories.
Right.
Right.
And just a clarifying question also for Carol, if I could. In the first year, we had a deadline to produce a plan, but there were revisions that would be accepted later on. Is that still the case, or was
That's
that
still
only
the
for the
case.
initial?
Right, and that's actually, we've asked that twice already and said, yes, we can.
Okay, I was just clarifying for
No, no,
myself
yeah,
too.
yeah.
So if something came up that was really to Mayor Pro Tem's Mason's question, if something really new information came towards us and we said we can't ignore this issue or something, opportunity comes, we could do a revision potentially.
Right. So that's why I'm trying to get us to kind of move from the A through the G and move on to the more specific, but I think it's good to know that if we say 0 and 9, that we still can add one down the road. And if that might be even simpler, going back to my original conversation, is do we want to go ahead and look at that list, again, I'm not sorry, Liz, if you could go back again to that original list. That was crosswalked for us, which I can only imagine how this meeting would have gone if we hadn't had this. So now you. Oh, yeah, a big thank you, couldn't have done the aid coag. So DA McLaughlin, I hope you'll say to the Attorney General, I will thank him too, but to the coag, how helpful this was. Cause it didn't, this was very, very helpful. We see all those and we've added E, and I know we sounded like there's a lot of things on here. But it sounds like if we only picked one, thank you, Shay, for being here.
Yeah,
and all the
sorry, I think it's a
information.
little early.
We appreciate your time.
Always. Thank you all.
So even if we said. I know we're supposed to be, I think we're gonna go, is it 3:30 or 4 today? 4, that's what I thought. Sometimes I'm running with my hair fire, I'm not sure what's the living hour by hour. So E, if we said E based 1. Then we can always add to that once, and then have more and then come back and I'll just look at some what programs are available, we know have data driven stuff. So so now looking at J3, J1, 1 and 6, B2, and we've added another E, and then we have G9, G0, H9. It's also, and then administrative services. Are we okay keeping the numbers that are up there now on the list going forward?
Yeah, I was just going to comment that we were referencing G. I'm fine with keeping G0 and G9. And then yes, I was looking at moving forward to and discussing the other ones, but as far as G, I think that looks good.
Okay. H9. Let's do that way. Let's do it that way since we have some more time, but I want to be mindful of the time, but this will also help with Laura and them to know at least that's the direction that we're kind of looking at, Laura, then those ones, I'm trying to get us to a point where you can work from. Does that make sense?
As long as that's reflected in the minutes, Liv, that'd be
Right.
great, so that I make sure I got it all from this meeting. Thank you.
So H9, we know this is expanded to other areas of the county, which I think has been very helpful. Does anyone have a problem? And again, doesn't mean we can't add more down the road, but everyone okay keeping H9 going forward? Anyone opposed? Okay. B2. Yeah, go ahead, Beth, sorry.
There, and I know we can add, but there are definitely others in H that I think also fit with what drug and mental health not been doing, so we might, I don't know if it's helpful or if we need to, right? Because like the mobile units that offer or provide referrals to harm reduction, so I don't know if it has to all be incorporated, that's where I'm getting confused.
Well, what I'm trying to do is get us to, what I'm trying to do is move us from the letters, and then what we have been doing, because we talked about how we were trying to keep certain programs, we just don't know the percentage yet. And now keeping that, so we can kind of get that off of our brain.
Yeah.
So then we can see what else we might want to add.
Oh.
but Laura's team is gonna come back with some data analysis on what has been, what other things, what things have been effective, and help us come back with kind of an overall analysis before the next meeting. But if we show this direction, like, hey, we're good with these, and then when we can come back and say what else, you know, will help us with that.
happening?
Yeah.
Well, and I would offer, we could bring it in a format that shows recommended prioritization of the ones that already got identified in this meeting based upon the data from these studies.
Right. That would help with us, but does that make sense? So I may be confusing, I'm trying to get us to that point so they have information to come back with us. Right now, they don't know if it's all those numbers.
Right, and I think that's gonna help us a lot. I think it, again, I just don't want to hash out too much, but it's just confusing because there's a lot of repetitive stuff. So to pick just one is really hard.
But that's not,
Which I'm sure you experienced.
So, but that's what we've tried to say, that, doesn't mean we can't add. And doesn't mean that we have set a percentage or number yet.
Right.
But we have to, at the next meeting, have at least the letter and a number.
But not necessarily have to have a number, it sounds like.
No, we do have to have,
To the extent
Yes.
possible.
right, we can't have just J.
Yeah.
We have to have.
G, there isn't a good number that goes with our stuff, so we have to go with G0.
Right,
Yes.
but they've
Yeah.
approved that already.
Yeah.
So,
No, I'm good. I'm
Okay.
good.
so I'm trying to get us from there, so then staff can come back with that direction. I'm trying to get to that, we're good from that, and now we're gonna come back with that prioritization and numbers, so then we know percentages and what we'd like. That's what's gonna help us, is we know this is where we're at, and they're gonna come back with prioritization and percentages that will help us maybe determine the amount of the buckets. Does that make sense?
Yeah.
That'd be good feedback.
Trust me, we're all buzzing through this with you, and again, I'll say, thank goodness to AG's office to help us crosswalk this, because this would have been extremely hard for us to figure this out, because you're right, they're overlapping and yeah, but this is different than we did before.
It is.
Because they changed this and narrowed it, and it's narrowed, it's a narrow guardrails, guidelines, what we can do.
Yeah.
So, now we're at B2. Everyone okay keeping B2? Anyone have any opposition? Okay. D1 and D6, everyone okay keeping D1 and D6? Any opposition?
I think, are D 1.6?
Is it, oh yeah, D1.6, thank you, I need my glasses,
Thank you for that clarification. I was confused.
thank you. I should look at my list instead of the screen. Anybody want to help me get an appointment to get new glasses, since I haven't had the time? 1.6, yes, I see it now. Okay, everyone good with 1.6? And notice, I appreciate that they didn't, before the old buckets, remember how I had said in our annual report, I wanted to change that, but that was the name of the bucket, we couldn't change it because I felt like that's not what we were doing. So I'm really glad that they changed that, so it's more, I think, addressing what that is. All right, J3. Anybody, everyone okay? Anyone opposed? Okay. So can I have a motion that we are keeping those numbers attached to those buckets for the next meeting, and then that we will have Laura Walker and her team take those buckets and the old data reports and help us have a prioritization and analysis. To ask us to direct our wonderful director, Laura Walker, to bring that back for the next meeting so that we can have a more detailed place to work from to talk about percentages and numbers going forward. And not saying we couldn't add numbers, but So can I have a motion for that? Trustee Youngman, did you have another question?
Yes, I did. I'm wondering, because of the earlier comment about the dashboard and the staff doing so much of that work, do we need to, you said we needed to maybe think about increasing the admin costs for that. Do we need to add number 2 into J just in case? Can we talk about that a little bit more?
I think that's a great point. Right now, as you can see, we're staying fairly within, but we're bumping into it right now, but that might be okay to add to the bucket. So we have it in case we do need to have a more robust conversation or have more work on that dashboard. And I want to also remind us all that there's a law now in place that will be starting to be effective in a year, that everything has to be translated and certain accessibility things, and that costs a lot of time and money. So I don't know what those costs are gonna look like. So that might be thank you, Trustee Youngman, that might be a prudent thing to add to J number 2 as well. We don't want to dry that all up out of administrative costs, since that's a category we can spend money for. Would there be okay? Would someone like to make that motion to add, so we have J 3 and 2.
I'll make a motion to add J2.
Is there a second to that?
Yeah, I'll second that.
Okay, so thank you for that friendly amendment. So now we have, let me just read through again. So we'll have J 3 and 2, D 1.6, B 2, G 9, G 0, H 9 in administrative costs, and bucket E. And yeah, I mentioned D. That's right. I mentioned D. So motions on the table without further discussion. All those in favor? Aye.
Aye.
Anyone opposed? Okay.
So for those of you interested in math, which is everyone, if you took your 8 buckets and took the money you have, you would have $238,000 in each of those particular items.
If we split them evenly.
If you just evenly spread them. So, that's one way to think about it, is you could evenly spread them and then go, wait, that one's too big. Let's take some out and put it down here, that kind of thing.
And I think that's what Laura's gonna try to help us spread that out. So,
Make some suggested targets
yeah,
for consideration.
suggested targets, yep. So I know this was confusing. Oh, your trustee, I'm sorry, Mayor Pro Tem Mason.
Yeah, thank you, Ms. Block, for that clarification. And so, yeah, certainly I look forward to Ms. Walker's team as far as what that breakdown might look like next time. I would encourage the council to look at if we're looking at the summary by category at the top here in those 2 blue columns, the 2023 and 2024. Obviously, we've got little over $1 million less this year than we had last year. So I probably, what I would encourage us to do, even without looking at Laura's numbers yet, I would consider us to, I would ask that the council considers to keep kind of the same ratios that we kept for 2023 for 2025. And probably what I would say is take $100,000 out of the leadership and coordination bucket and the treatment bucket, stuff that into what we would now call category E. And then we're going to have to do something with the prevention and harm reduction buckets and put some money there into the recovery bucket. But I would ask that we keep kind of the same ratios, because I think when we had first, kind of talked about this and everybody had prioritized what was the most important to them. And those were the numbers that kind of rose to the top. So just for that kind of historical clarification.
Thank you, Mayor Pro Tem, I appreciate that. Okay, so we got through all of these items on our agenda. I was worried how this was gonna go, so I appreciate everyone's patience and it's great that we kept clarifying because as you can see, it's different this time. And so we will still have time for presentations. Obviously, if we add bucket E, we're gonna have that helps inform our agendas going forward. And also the veterans bucket, I think would probably be with treatment recovery. I'm not sure where that's gonna fit. So if they have a proposal, so just wanted to kind of thank you all for your patience. And I know this is a lot and it is, and I'm sure for the COAG as well. And the work that the Attorney General's office, I know we're kind of saying, well, this overlapping and confusing, but if you see this is a tremendous amount of work. And I know they're trying to also navigate this and figure this out and to also provide guidance to 17 different regions who have different levels of resources and are at different points in the process of how they're operating, because they're all operating differently. And so I want to just kind of shout out to the AG's office for trying to help provide this guidance. I know it seems a little confusing. I'm sure we're a little like scratching our heads and trying to wrap around it. But I want to just say, I know as we think about how we feel about it, I'm sure as we roll up, they've been really struggling with this as well. And they've been going to some of these national conferences and having these conversations and presenting and seeing what others are doing. And also because we've been, I just have to say, because we have been doing some great work, and I commend you all for your commitment and work here. With getting accolades or positive kudos comes greater scrutiny, which is maybe a good thing and not so good thing. So we're saving lives, we're making progress. I feel like we're being good stewards of this money, we're making a difference. But just know we might get more questions. Doesn't mean we're doing anything wrong. But we also should know that people are kind of trying to figure out what the heck's going on, because you can see, if you haven't heard me talk about this with the suicide rates, the last 4 consecutive years we're the only county to see a decrease in suicide rates for 4 years in a row, 25% overall. And I think we're also seeing a very significant decrease in opioid overdose deaths, which is great because during the pandemic it was really frightening. So I think there's a lot to celebrate there. I feel like we're on a good path and trajectory. Now we just need to figure out how we keep that going in that direction and how we amplify and make those numbers even closer to zero, because that would be the goal, right? To save all these lives. So thank you all for your patience. I know I was trying to navigate this because I'm still, like I said, we've been in these meetings listening and still going, what? And so, and also, we'll also have on the agenda the capital assets policy, hopefully back by then. Because I think we also have to have that in place before we start allocating in case we have some other requests for capital assets. And so I'd like to make sure we kind of look at that as well. And we'll try to get that out. So please hold on to your packets so that maybe we can save some paper. So maybe Liv doesn't have to print all these out again.
Yes.
So I'm gonna ask Liv not to print these out again.
Yes.
Is that okay? To save paper in her time, so these, and so I know trustee Youngland and trustee Mason, if you're coming in person, let us know, because then we'll print you out a copy, but I'd like to save paper in her time by not printing these all out.
Yes, trustee Youngland already did it. She showed us papers just now.
Thank
She
you.
printed her own, so.
Awesome.
She's covered.
Thank you. So with that, any other burning desires, questions? Thank you for your patience as I'm trying to navigate this all with you too, because trust me, when we've been in those meetings, Carol and I are really, I'm like, oh, thank God, Carol's here too, because I couldn't do this by myself, right?
We both have to hear it.
Yeah.
Hopefully
We're hearing different things. I think we're also hearing different things, so we're just like, whoa.
And thank you both for attending those. I know I have a weekly meeting at
Yeah.
our meeting at that time. I can't make it.
And it's really great conversations, and I have to say, I'm so thankful to the Attorney General's office and Jamie and Jack, because they are really working hard and very engaged, and it's really been great conversations. So we will see you, but I will reinforce, because I said this the first year and last year, I've been kind of the one like, we gotta get this done, we gotta get the money. And now, last time we got a little wiggle room, there's no wiggle room. Get it done. And if we don't have it done, then we can't give the money to the grantees. Remember, we have $800 left right now. So just kind of reinforce that, okay? So we can talk about, this is all in favor, but we only have $800 in that for right now, so we want to give that out. We have to approve this. So I think, do we plan for 2 hours next time?
Or we have, yeah.
So can I have a motion to maybe, let's just give ourselves some time. I have a motion to extend our next meeting for another 2 hours again.
I'll move it.
Trustee Youngman.
I'll second that motion, and I just wanted to say thank you guys for your time. I wish I could be there. I'm recovering from COVID, but hopefully next month I'll be able to be there in person.
Thank you, Trustee Youngman. I hope you feel better. So we have a first and a second. All those in favor? Aye. Anyone? Okay. We're just,
Motion to adjourn.
motion and MJ?
I have one really exciting announcement. for
Cool.
council. So we worked together with Sunstone and North Range actually, together a proposal for the Attorney General's Innovation Funds, and we're actually recently notified that we were awarded for that, and that actually brings together the Center of Excellence Peer Recovery Leadership Model for the region. So
Oh, excellent.
we get to start playing and planning, but I will certainly keep the council updated as we move forward with that.
Would love to have some more details on that. Can you send that to Liv so we can share that? How much is the amount?
It's for $750,000 for 2 years.
Excellent.
Yeah.
Congratulations.
Yeah, very
That's great.
exciting.
Really great. So we're getting more money. So we have our first and second for adjourn. All those in favor? Aye. Anyone opposed? Everyone lining out? Okay, everybody have a great day. Thank you for your time and your patience. And thank you, Carol. And thank you, Carol. I couldn't do this without you. Thank you. For figuring all that stuff out.
He was staring at. Oh my God.
Yes. I really thought.
Beautiful.